this pre-conference session of INS. It's an honor to see such a dedicated group of professionals, nurses, clinical instructors, our industrial partners gathered here. Today's program has been designed with a very important purpose to strengthen our knowledge and skills in intravenous therapy, ensuring patient safety, quality of care and adherence in international standards. So, going ahead, now I would like to invite our Director Nursing Ma'am to deliver the introductory speech and inaugurate the ceremony, followed by the lighting of the lamp.
Welcome to Medanta, all the participants from outside, warm welcome. Whenever we think about IV access, I think so when the patient comes to the hospital, first experience is how you secure the access, and that defines the experience of nursing and also the hospital image. So IV access and peripheral line, why INS is putting lot of efforts on that, that's the only invasive line which is authorized for the nurses to go ahead, and I think so that is our main core responsibility. So currently whenever we see the skills of the nurses, there are a lot of things we need to learn, and the INS has gone through a lot of literature, and with the International Nursing Society of Infusion, we have selected 10 chapter which is infused practices. So most of the hospitals are going ahead for the accreditation of the infused practices as well. So that much importance is there for the IV access. So when we talk about the IV access, I think so it's a peripheral line, and it is the most important for each and every patient. I think so when they are in the hospital first, second, third time, or maybe fourth or fifth time also they will have the experience. But the way you put the line and you secure the access, that remains with them all the time. And there are today's workshop, there are a lot of influences given to peripheral access, there are workshops, there are lectures delivered by the eminent personalities. So I hope that you will take something from that and learn and practice whenever you go back to your practice field. So thank you. I will not take much time because there are a lot of things has to be done for within 4 to 5 hours. So enjoy the session, learn and take some takeaway message from this workshop. That is what INS wants, that all the nurses should go ahead. So thank you very much for coming here, and I hope that your stay and till the time you are here, you are safe and you enjoy the trip to Medanta event. So thank you so much. Thank you.
INS guidelines and evidence-based practice. Enhances our technical skills in insertion, maintenance and complication prevention. Develop confidence in delivering safe IV therapy while reducing risk of infection and extravasation. Standardized our nursing practices so that every patient receive the same high quality of care.
So you have a good next few hours of learning, and I am very happy to be a part of this. So I am Dr. Ashmita and I am the clinical specialist for 3M, and I must first appreciate that Priscilla ma'am, who is the state head for INS UP chapter, for taking this initiative. Ma'am is one of the most vibrant leadership that we have seen in recent times, and she always takes initiative where we can always encourage learning, where we learn from each other, and she's very, very energetic. So I hope ma'am is hearing all the kind words. I am appreciating her. So we will start with the session, and I would like you to please ask me questions if you have any. The session, I don't have much time, but I am very happy that I got the I'm getting this opportunity to introduce the topic. Okay, so PIV, so peripheral intravenous is something which already everyone is mentioning is very common in the hospitals. In fact, I'll just tell you one small incident. There was the reason I'm saying is why it is so important. There was some patient of mine, or rather known to me, who got admitted because he was caught in a very bad traffic accident, and he was almost, very critical, very critical, and he was lucky to get admitted in a very nearby hospital. And that hospital was a very big corporate hospital, and the neurosurgeon team, the nurses, they actually went and did an emergency surgery on the patient. Luckily, the patient survived, which was a big thing, because throughout the time the surgery was happening, we all were praying for his safety, that kuch bhi ho jaye, God inko bacha lena is baar. Okay. Now when he came out of the surgery, of course he had to stay a few more days in the hospital, because that's how things are. Okay. When he came out of the hospital and there was a patient feedback form, he wrote very badly on the form. You know what he wrote? Basically, unfortunately, for some reason not known to us, the patient ended up having phlebitis. Thrombophlebitis, we all know, right? And it was a painful condition for the patient, right? And he ended up writing bad things about the nursing care. So, this is what is human nature. We tend to forget the good things, and we try to remember the bad things. So this is how unfair life is. So whenever we are doing our best, in spite of the best treatment, in spite of our best care, if something goes wrong, the patient satisfaction levels goes drastically down. So I see there are many people who are from the nursing students. So you are yet to get into this journey, but once you get into this journey, you will see how critical your role is. Okay. So having said that, today we will learn a lot, and I'm just going to introduce you to the topic. So peripheral intravenous catheter actually is one of the most common procedure which is done in a patient. In fact, in a hospital, 70 to 80% of the patients end up with a peripheral line. But what happens if we do not take care of it? These are the complications which may happen. So if you are not careful, what are the complications?
They provide structure, and also they are avascular. They are avascular. So it means that they are dependent on something for diffusion. Clear? So मतलब उनके पास अपना खुद का कुछ नहीं है, so वो diffusion भी किससे दे रहे हैं? डर्मिस से. So basically वो एक स्ट्रक्चर प्रोवाइड करा रहे हैं आप हमारे स्किन को, ठीक है. सेकंड आपका क्या आता है? उसके बाद आने के बाद आपको अपने नहीं जाना है. नाउ यू हैव टू लर्न. सेकंड वन इज लर्न. तो उसके बाद आप देखो इसको लर्न ऑफ. दिस इज लर्न ऑफ, एंड आफ्टरवर्ड्स वी विल third one is now you advance cannula. So after learn off we can advance the cannula. ठीक है. The last one is sorry. Now we have to do tonic. Okay. And the last one is steroid. उसके बाद आप इसको बाहर निकालें. ये आप सब याद.
सॉरी, मल्टीपल कैनुलेशन और रॉन्ग एप्लीकेशन. और क्या रीजंस हो सकते हैं? रॉन्ग. ओके. तो हम सबको पता है कि कॉम्प्लिकेशन क्यों होते हैं और क्या रीजंस हैं. अब
ओके ओके करेक्ट करेक्ट ओके ओके. एंड डू वी आस्क अ पेशेंट की मतलब आपका डोमिनेंट हैंड कौन है, राइट हैंड है, लेफ्ट हैंड है? ओके. सो हम किस हैंड में करते हैं कैनुलेशन पहले? करेक्ट. देन जब वंस वी डिसाइड द आर्म, देन व्हाट विल बी द नेक्स्ट स्टेप? हम क्या करेंगे उसके बाद? राइट.
We put all the required articles, things like first of all we put gloves and cleaning skin with solution.
Right.
And tourniquet.
Right.
Gauze pads and cotton balls, series, 10 ml series for flushing.
Right.
And needle obviously for NS.
Okay.
Flush.
Okay.
And puncture box.
Great. अब हम कैनुला लेंगे. देन आपने कैनुला डिसाइड कर लिया. नाउ यू हैव डिसाइडेड द साइज ऑफ द कैनुला आल्सो. देन आपको इंसर्शन साइट आइडेंटिफाई करनी है. तो इंसर्शन साइट आइडेंटिफाई करने का क्या मतलब व्हाट इज द आइडियल वे ऑफ डिसाइडिंग एनी वेन? कैसे करते हैं?
Sir, मतलब
कौन से दो चीजें होंगी जिससे हम आइडेंटिफाई करें हम यहीं पे हमें लगाना है वो कैनुला?
सर फर्स्टली ब्रेन वहाँ पे मतलब विजिबल होगी।
इजिली विजिबल, इजिली पाल्पेबल, करेक्ट। चलिए आप करिए इसमें।
If I have to, I have identify that I have to dorsal arch, basilic arch. I have to put cannula in dorsal basilic arch.
ओके,
I have just.
हम बेसिकली आर्क में लगाएंगे।
नहीं सर, मतलब basilic arch जो है पूरा उसको आइडेंटिफाई करेंगे, समूह सिफेलिक वेन
कभी भी जंक्शन पे नहीं लगाते हैं।
जंक्शन में नहीं सर, मैंने आर्च पूरा।
ओके चलो ठीक है।
उसके बाद हमने आइडेंटिफाई किया, फिर हमने टॉनिक
आइडेंटिफाई करने के बाद ठीक है, आप टॉनिकेट करो। ठीक है, आप मान लो आपने टॉनिकेट किया, तो मान लीजिए आपने कौन सा आप एक मेरे को उंगली से बताओ आपने क्या साइड आपने सेलेक्ट किया है। ये वेन आपने लिया, ठीक है। तो इस टॉनिकेट हम नॉर्मली कितने डिस्टेंस पे हम टॉनिकेट कर दें? जैसे फोर फिंगर फ्रॉम द साइट ऑफ इंसर्शन, ठीक है। चलिए आपने मान लिया यहाँ पे आपने टॉनिकेट कर लिया, ठीक है, इजिली पल्पेबल वेन। अब आप क्या करोगे नेक्स्ट स्टेप?
स्किन पेट करेंगे,
करिए, ठीक है। ले लीजिए आप एक ओपन कर लिए, वही सब लोग यूज कर लेंगे। ठीक है, ठीक है।
उसके बाद से फिर इसको
इट शुड बी इनर टू आउटर इन अ सर्कुलर मोशन, ठीक है। चलो
वैसे डिस्कार्ड कर देंगे, बस किडनी ट्रे होगा तो
ठीक है,
डिस्कार्ड कर रहे हैं।
ठीक है,
फिर हम लोगों ने, फिर उसके बाद हम डस्टिंग करेंगे
हाँ।
आफ्टर क्लीनिंग।
ठीक है,
हम ओपन कर सकते हैं।
हाँ बिल्कुल 100% ओपन करिए, इट इज ऑल फॉर यू ऑल,
ओके सर,
है ना, पूरा यूज करिए।
ओपन करेंगे। उससे पहले हमने सबसे पहले सर एक इससे बहुत मेजर था जो मिस हो गया,
हाँ,
हैंड हाइजीन
हाँ
हमने कर लिया। उसके बाद से हमने स्किन प्रिपरेशन
यू केम टू मी, मतलब आपने हैंड हाइजीन कर लिया था, मैं आई अज्यूमिंग इट कि आपने कर लिया है वो, ठीक है। चलो ठीक है,
करेंगे, फिर इसको ओपन करेंगे, आपको रिमूव करेंगे,
ग्रेट,
कैनुला को चेक करेंगे। उसके बाद सर ये जो चेक करेंगे कि ये कैसे लॉक है। उसके बाद फिर हम इसको ऐसे होल्ड करेंगे,
राइट,
वैसे हम जस्ट प्रेस करेंगे और स्किन को डाउनवर्डली स्ट्रेच आउट करेंगे।
ठीक है, एंड नॉट ओके करिए, परफेक्ट,
जस्ट मूव किया सर,
ठीक है।
और अगर हमारे भाग में हम ब्लड देखेंगे,
प्राइमरी फ्लैशबैक देखेंगे,
प्राइमरी फ्लैशबैक देखेंगे,
ठीक है। सेकेंडरी फ्लैशबैक आपका वो चैम्बर में आता है, ठीक है। प्राइमरी फ्लैशबैक कैसे देखते हैं? पहले स्टिलेट को थोड़ा बाहर निकालेंगे, निकालिए आप स्टिलेट को बाहर, थोड़ा सा यहाँ पे दिख जाएगा, ठीक है। देन वापस से स्टिलेट को अंदर पुश करना है, थोड़ा कैनुला अंदर जाएगा। नाउ यू नीड टू टेक आउट द स्टिलेट, बहुत ज्यादा अंदर है, चलिए ले लीजिए, परफेक्ट, बहुत बढ़िया।
Concrete dreams with a neon glows. Every block tells a tale the whole city knows. Rhythms in the shadows where the cold wind blows. Life's a gamble on these streets, anything goes. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside.
प्लीज ओपन कर दीजिए।
Paint the struggle and climb. The clock keeps spinning, but I'm owning my time. Words like puzzle pieces fitting tight in the rhyme. Snares punch louder than the city's own chime. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Beat kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Each corner whispers a hero fell. Smooth flow cutting through the urban scale, where truths are spoken and tales unveiled. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Beat kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Where the neon glows, every block tells a tale the whole city knows. Rhythms in the shadows where the cold wind blows. Life's a gamble on these streets, anything goes. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story in sight. Paint the struggle and climb. The clock keeps spinning but I'm owning my time. Words like puzzle pieces fitting tight in the rhyme. Snares punch louder than the city's own chime. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story in sight. Lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Where the neon glows, every block tells a tale the whole city knows. Rhythms in the shadows where the cold wind blows. Life's a gamble on these streets, anything goes. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story in sight. Paint the struggle and climb. The clock keeps spinning but I'm owning my time. Words like puzzle pieces fitting tight in the rhyme. Snares punch louder than the city's own chime. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. keep my story inside. At night, soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story in sight. Anything goes. Moon that echoes through the alleys at night. Soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside.
तो कैनुला लगा सकती हूँ?
Yes, you can do it. So first thing is what we have to do is
ID band check करेंगे.
ID band check. So cross checking with the ID band. Okay. Now next point is
The insertion side.
yeah, check with the veins. So which vein you have to choose? So vein selection on the basis of the patient's requirement.
Yes, sir.
So what is the requirement of this patient?
Patient.
So suppose common medications we are going to give them. Okay, so you can choose. So which one you are choosing? Metacarpal vein. Okay. So application of tourniquet. Seal it tight. Okay. Now clean the vein. Yeah. Till 10 to 15 seconds we are cleaning the vein on circular position and then let it dry. Meanwhile we are checking the patency of the cannula. So check it, take it out, check if the cannula is working fine, throw it off. You can't touch it, okay? So you can't touch the bore, okay? It's fine. Now hold the wings. Meanwhile the wound is clean, okay? Now first point is insertion and blood return, and then second is level off, and now take it. Now advance the cannula. Now tourniquet removal and stellate removal. Very good. And immediately we are going to flush it. So flush करने के लिए पहले हम we have to take out, pull back करना है and then we have to follow, okay? उसके बाद you can connect these. Remove this first. And now we'll pour the dressings. Good.
Darkness to light, deep kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Graffiti on the walls paint the struggle and climb. The clock keeps spinning but I'm owning my time. Words like puzzle pieces fitting tight in the rhyme. Snares punch louder than the city's own chime. Boom bap echoes through the alleys darkness to light. Beat kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. Street lights flicker on this endless trail. Each corner whispers a hero fell. Smooth flow cutting through the urban scale, where truths are spoken and tales unveiled. Boom bap echoes through the alleys at night. Soulful samples lift the darkness to light. Beat kicks pounds like a heartbeat fight. These gritty vibes keep my story inside. At night, soulful samples lift the darkness to light. Deep kicks pounds like a heartbeat fight. These gritty vibes keep my story in sight.